Hi, welcome to this video introduction of our article, Integration of Teaming Therapy and Mixed Reality Simulation as a Remote Learning Modality for Couple and Family Therapy Graduate Training Programs. My colleagues and I at Antioch University, Seattle just finished up a 6-month application of AAMFT's Mixed Reality Technology in our CFT program, and we're excited to tell you about our project. As it did at so many universities, the COVID-19 pandemic affected Antioch's mental health graduate students in some major ways. Students in internship were faced with fewer clinical hours, less access to relational clients, and for some, their internship sites even closed down. In response to this crisis, our team worked with COAMFT and AAMFT to develop a plan to use the newly unveiled mixed reality simulation to supplement students' internship experiences.
We decided to use a teaming approach based in Milan's systemic therapy for our project, since it adapted easily to Zoom and gave students the maximum amount of hours for the time spent. Our selection process prioritized students who were close to graduation and whose internship experience had been most impacted by the pandemic. For those of you who have not yet seen the mixed reality simulation, it's pretty fantastic. A human interactor represented by one or several avatars on the screen works from a clinical scenario to give students the opportunity to practice therapy in a low-risk environment without real clients present. Combined with live feedback the clinical supervisor was able to give and the observations and inputs of the student reflecting teams, this was really a learning experience like no other.
Over 2 quarters, a total of 16 students completed the fully online 10-week program in co-therapy dyads. Using a structure derived from Milan systemic therapy, we made sure that each student was either actively conducting therapy or participating in a reflecting team, similar to how they might from behind a one-way mirror. The reflecting team helped co-therapists develop hypotheses, they fed them interventions, and provided feedback on the success of each session. As researchers, we measured several aspects of students' experience. This includes perceived counseling efficacy, the acquisition of CFT core competencies, and subjective experiences during the therapy session. Students also provided qualitative data by participating in focus groups after program completion. Preliminary responses from these focus groups were positive, suggesting that students liked the program and considered it an effective way to develop therapy skills.
Although preliminary results are encouraging, the program faced several limitations that we encourage you to read about in our article. Despite these, our team believes this innovative framework provides both realism and safety, so students can engage in experiential learning in an online setting. As a research team, our next steps are to analyze the qualitative and quantitative data we collected and consider whether those data support the expansion of this program beyond our pilot study. Thank you for taking the time to learn about our integration of teaming therapy with mixed reality simulation as a remote learning modality. We hope that this project inspires creative ways for graduate programs to courageously confront the COVID pandemic and to support students in the inevitable transition to online learning.